Hello everyone. Hello everyone. This is me Dr. Muhammad Shoaib. The topic today we are going to discuss is about thyroid cancer. So our main learning objectives are: what is thyroid gland? What is thyroid cancer? What are the signs and symptoms? Causes of thyroid cancer? Classification of thyroid cancer? How to diagnose and treatment of thyroid cancer. So first we will start from our introduction about thyroid gland. Thyroid gland is a butterfly shaped organ located in the neck. Actually it is present in the anterior part of our neck. Has two lobes, left and right. They are connected anteriorly. It is a vital hormone gland. It plays a major role in metabolism, growth and development of the human body. It helps to regulate many body functions by constantly releasing a steady amount of thyroid hormones into the bloodstream. So, what is thyroid cancer? Thyroid cancer is a disease in malignant cells of the tissues of the thyroid gland. Thyroid nodules are commonly affected but usually are not cancerous. As you can see in the pic, the highlighted part is showing our thyroid gland and it is malformed. So it is a sign of thyroid cancer. If we talk about signs and symptoms, there will be a lump of swelling in the neck of the patient having thyroid cancer. Patient will be having pain. That pain sometimes radiates to ears too. Patient will be having difficulty in swallowing, difficulty breathing and constant wheezing. Hoarseness not related to cold and continuous coughing that is not related to cold. So if you can see in that pic, the patient's neck is swelling. If we talk about the causes, so first of all we will have environmental causes. Environmental causes are usually radiations. Either these are X-rays, gamma rays or ionizing radiations from natural or artificial sources. They can cause changes to our thyroid gland and ultimately a thyroid cancer or tumor may develop. If we talk about genetic causes, multiple neoplasia type 2, which particularly increases the medullary form of the disease. So MEN type 2 causes medullary thyroid cancer. If we talk about our diets, then dietary causes are iodine deficient diets, because they lead to increase the thyroid stimulating TSH level and they cause goiter. So if a person lives in an area where iodine deficient diets are in routine, then TSH level will be increased and they will be considered as goitrogenic. If we talk about thyroiditis or Hashimoto's disease, it can also develop into a form of a cancer that is called lymphoma. External radiation are also a main source of thyroiditis. Increased age is a causing factor as well. Nuclear power plant accidents. If a person works in a nuclear power plant and there is explosion of radiation or he is exposed to radiation in that power plant, he can get develop thyroid cancer. Food source contaminated with radioactivity. These radiations damage the thyroid cells or tissues and ultimately a mutation develops and thyroid cancer develops. Radioactive iodine concentrated in the thyroid gland. So Radioactive iodine is also a major cause of thyroiditis. If we see classification of thyroid cancer, we will be having cancer and its various variants, follicular cancer, anaplastic cancer, and medullary cancer. First, we will talk about papillary cancer. Papillary cancer is the most common type of thyroid cancer. It accounts for approximately 80% of total thyroid cancers. Papillary carcinomas are actually slow growing and differentiated cancers. They can develop in one lobe or both lobes of thyroid gland. They can spread to lymph nodes. They are usually treatable with good prognosis. You can see in these two pics. First one is histological and the other is microscopic. That these are differentiated cancers. If we talk about follicular carcinoma, so this is the second most common type of thyroid cancer. Accounts for approximately 1 out of 10 cases of thyroid found in areas of iodine deficient diet. So iodine deficient diet is a major cause of follicular carcinoma. It is more aggressive. It usually do not spread to lymph nodes, but it spreads to other body organs just like lungs or the bones. Follicular carcinoma is a differentiated form of thyroid cancer. Other forms of thyroid cancers are usually not differentiated as compared to follicular carcinoma. It also has good prognosis just like papillary carcinoma. So if we talk about medullary carcinoma, it caused 6 to 8% of total thyroid cancers. Among these are 75% sporadic, 25% hereditary. They develop from neuroectodermal parafollicular C cells. They show elevated serum calcitonin. Neuroectodermal parafollicular C cells secrete calcitonin hormone in our bloodstream. If we talk about anaplastic cancer, it is 1.6% of total thyroid cancers. It usually occurs between 5th and 2nd decades of our life. Show rapidly expanding mass. That mass is actually greater than 5 cm in 80% of cases. Patients have short history and multiple local symptoms. How to diagnose thyroid cancer? There are following steps to diagnose thyroid cancer: history collection, physical examination, thyroid scan, thyroid function test, biopsy with fine needle and large bore needle, ultrasound, MRI and CT scan, radioactive iodine uptake studies, and thyroid suppression test. History taking. In history taking, age is the most important factor because different types of thyroid cancer develop at different stages of our life. Multinodular and solitary nodular goiter as well as colloid goiters are found in women of age 20s to 30s, and papillary carcinoma is seen in young girls and follicular carcinoma is seen in middle-aged women. Anaplastic carcinoma is a disease of old age. So by knowing the age of a patient, we can guess a diagnosis about thyroid cancer, whether it is multinodular, solitary or papillary. If we talk about personal history, the patient will be having following: lump or nodule that can be felt through the skin on the patient's neck, changes to his voice or her voice, increasing hoarseness, difficulty swelling. Patient may also present with cough. The most important is physical examination after history collection. First of all, examine the patient's neck from the front, then go to back side of the neck for examination. Then ask the patient to swallow his saliva and check for any swelling that is moving. Then palpate the lymph nodes of the patient. Thyroid scan. Isotope scanning used to be the mainstay of investigation of discrete thyroid swellings but has been abandoned except when toxicity is associated with nodularity. If we talk about thyroid function test, then we will assess TSH and thyroid hormone level. If discrete swelling is confirmed chemically, it indicates that either a toxic adenoma or toxic multinodular goiter is present. You can see in these pics that how thyroid scanning is done and thyroid function test is performed. FNAC, fine needle aspiration cytology. It is ideally done under ultrasound guidance. It is highly specific and sensitive. Ultrasound improves this further, particularly in parts cystic, in which ultrasound allows targeting of the solid element for biopsy. But FNAC has a limitation that it cannot distinguish between follicular adenoma and follicular carcinoma. If we talk about the treatment, drug treatment is thyroid replacement therapy, radiation therapy, radioactive iodine therapy, drug-Thyroxine therapy. If we talk about thyroid replacement therapy, radioactive iodine is the treatment for overactive thyroid. It is reliable because it targets only specific cells that are cancerous of thyroid gland, and there is no or little exposure to our body's normal cells. But after this treatment, patient may feel tiredness or swelling in their neck for a few days after treatment. We talk about radiation therapy. Then external beam radiations are usually used. They are high energy rays. They destroy cancer cells or either stops their growth. A carefully focused beam of radiation is delivered through a machine outside the body. It is used to treat medullary thyroid cancer and anaplastic thyroid cancer. Now we talk about drug-Thyroxine therapy. So levothyroxine is a main drug that is used to treat thyroid cancer. It actually is used to treat hypothyroidism. It controls the thyroid hormone level. Levothyroxine is taken to replace the missing thyroid hormone thyroxine. If we talk about surgical treatment, then thyroidectomy is performed to remove the malfunctioning thyroid gland. It is the common surgery for a thyroid cancer. As with lobectomy, this is typically done through an incision a few inches long across the front of the neck. So lobectomy is also being performed with thyroidectomy. 3 operations are usually performed: total lobectomy, isthmusectomy, and subtotal lobectomy. After the surgical treatment, following precautions should be taken. Hemorrhage is the most life-threatening complication of thyroidectomy. Care should be taken while performing surgery, as it can damage recurrent laryngeal nerve, so voice paralysis can occur. Thyroid insufficiency may occur. Thyrotoxic crisis may also occur. Hope you guys like my video. If you like it, then kindly comment, share and subscribe my YouTube channel. Thank you so much.